My name is Beth Michel, and I'm a proud citizen of the Sana'a Nation, which is a tribe located in southern Arizona. I'm also Hopi and Navajo, and I was born and raised in Arizona, but I now work in Atlanta, Georgia. So my primary task or job is related to health intervention evaluation. So I am working with federal recipients that receive funding to implement their health programs, and I support them in their evaluation efforts. Yes, I would say about 75% of my work is directly working with tribes or indirectly working with tribes because they are partnering or collaborating with a state or local health department that has received federal funding. But all of the programs are focusing on either nutrition efforts or physical activity efforts to improve the health and well-being of the tribal communities that are either receiving support or partnering with a state department to implement those interventions. The evaluators that are part of these programs are sometimes university staff and faculty that have partnered with tribal communities. And then there's also tribal members, what you might refer to as community researchers, that play a big role in the evaluation. And then there might be a state level evaluator, and then myself from the federal side that's providing support for the evaluation. In my work, it's always national evaluations that are meeting the needs of the federal agency that is providing the funding. I think that there's still a lot of work to be done in terms of the field of evaluation, meeting the needs of tribal communities, indigenous communities in general. There's definitely still a lot of work to be done. But I think that slowly evaluators in the field are understanding that there are many layers to evaluation when collaborating with communities, and knowing that evaluation findings should benefit both or all parties involved with the evaluation. So I think that there's some progress happening, but I know for sure that there's still a lot to happen to still keep working on it. I think that evaluation can be successful when we allow our tribal nations and indigenous communities to really lead the evaluation, so that we're answering their questions, we're answering the needs that are priorities for them. In my past work, there have been many scenarios where we've had local evaluators that are supporting the tribe, or tribal members that are the evaluators that come into the evaluation and really take charge of it and own it. And when there are things that they might question or want to have adapted for the national evaluation perspective, it's really good for me to know that I can support them in their charge to ask for something to be changed because it's not feasible for their community, or it doesn't align or apply to their community. Because a lot of times these evaluations are that I work on, at least it's federal evaluation measures. And I think that sometimes when these things are developed, there's a state level, or at least there's a larger institutional level thinking that comes through. And it's not, I don't think that tribal communities and tribal nations are in the back of someone's mind when they're developing measures and outcomes to be achieved. So I think for evaluators who are also tribal members, or evaluators who have longstanding relationships with different tribal health programs in particular, it can benefit the evaluation to have that voice and that input on what's happening